Lots of kids have short attention spans. They get easily distracted. They have trouble following instructions or sitting still. While these can be symptoms of attention deficit hyperactivity disorder, there are other conditions that can cause attention problems too. I'm Allison Dubinski, a licensed clinical social worker at the Child Mind Institute. To avoid misdiagnosis, it's important not to overlook other, sometimes less obvious, reasons why kids might struggle with attention. Like anxiety. A child who appears to have trouble focusing in school could have chronic worries that teachers or even parents aren't aware of. For example, sometimes when a child takes an unusually long time to finish their work in class, it's not because their mind is wandering, but because they're struggling with perfectionism. Their anxiety requires them to do things exactly the right way. Obsessive-compulsive disorder is another condition that can be confused with ADHD. Symptoms of OCD often appear during the grade school years. Kids with OCD have an added source of distraction. They not only have obsessive thoughts, but they feel they must perform rituals or compulsions to prevent bad things from happening. The child with OCD might have trouble paying attention because they're compulsively lining things up on their desk or counting in their head, or they might be focused on needing to go to the bathroom to wash their hands. Trauma can also make it hard for kids to pay attention. Many symptoms of post-traumatic stress disorder, or PTSD, look like ADHD: difficulty concentrating, an exaggerated startle response, or hypervigilance. These symptoms might make it look as if a child is jumpy or spaced out and daydreaming. And when a child seems to be looking everywhere but the pages of their assigned reading, they could have a learning disorder. Children with undiagnosed dyslexia, a learning disorder that makes it extra challenging for kids to read, might fidget with frustration or feel ashamed that they're struggling. Or they might find ways to cover it up by acting out or shutting down. Finally, it's important to consider a child's ability to pay attention compared to others their own age, not every child in their grade. Immaturity may also be mistaken for ADHD. Research has found that both boys and girls who are the youngest in their class are more likely to be diagnosed with ADHD than the oldest kids. To get a proper diagnosis, a mental health expert should examine your child, ask a lot of questions, and observe their behavior. Then they'll be able to figure out what's actually going on and give your child the right treatment. For more information on ADHD and other topics, visit the Family Resource Center at childmind.org.